And we are live again. Hello, everyone. This is John Lynn from Sunrise Urology in Gilbert, Arizona. I'm so excited to be here with you today and to introduce you to Gina Ore from Passion for Patients. So we met, interestingly, at the Arizona Medical Association meeting where they were talking about physician burnout.
Yes.
And how to mitigate that and how and that there were a lot of physicians complaining about how they were just hating the amount of work that they had to do, and we were talking about suicide and all sorts of horrible things. And I piped up and answered some questions, and then during the intermission, you came up and introduced yourself, and I thought I learned about what you did. I thought, wow, that is so fascinating.
Thank you.
So I had to bring you out here. So thank you so much for being here. And we have a Facebook Live audience. So just to remind the audience, if you have any questions, feel free to leave them in the comments. And if you're watching this on a replay, I will have the links to Gina's practice or
email and my office.
email, website, and things like that in the video description if you need to reach her. So tell us about Passion for Patients and how did you get started in this business?
Thank you, Dr. Lynn, for having me also. This is very exciting to be here. So the tipping point for Passion for Patients, and I should probably start to let you know that I am not medically trained, although I've always worked on the fringes of healthcare. I've done fundraising in the West Valley. And so the tipping point that really got me going on Passion for Patients it was about 3 years ago, right about now, that my mother took a very bad fall. And she broke her hip and had compression in her thoracic area and cracked vertebrae. This was 10 months after we lost my father. And my mom was in a very well-known teaching hospital in the Midwest.
Okay.
Yes, teaching hospital in the Midwest, ICU for 4 days, and we watched as her attending physician came into her room, made notes in her chart, and left. The doctor never spoke to my mother, never touched my mother, and it was horrific for us to watch that. And that was my tipping point. What led up to that was having raised money in healthcare for as long as I did and getting to know physicians and working with generous donors who were elderly and watching what was happening in the patient experience. That the physicians were pressured to increase traffic into their practices just to pay the bills. And all the distractions of the workload kept them from connecting with the patients like they wanted to. And then I saw what that did to the patients at the very most vulnerable time in their lives. And I thought, there has to be a better way for the doctors and for the patients. So that helped us really launch Passion for Patients.
Okay, so tell us, what does Passion for Patients do? I read your bio and went on your website, and I understand that you guys do a lot of things to bring back better medical etiquette so that physicians and caretakers can take better care of patients.
So we do on-site training and facilitate workshops around interpersonal and communication skills. And we call it medical etiquette. And it's interesting, we didn't create or invent manners, but when we go in and we remind teams that there's better ways to communicate, we work a lot around listening skills, body language, the nonverbal communication. We have several different workshops that address all of that. One of them is incivility in the workplace. And patients very often will go onto an online review and say, I love my doctor, but I hate going to his office because the front office, the way I'm greeted and treated is not helpful. And we remind the people in our workshops that patients, they don't feel well. That's why they're coming to the doctor. They don't sleep well. They're scared about what's next. They're at a very vulnerable time in their lives. So if patients feel like there's a team that's part of their healthcare journey, that gives them some comfort. And I believe that healing begins long before the physician ever speaks to the patient. There's a whole culture around that can make the patient much more comfortable, much more confident, much more trusting. I also believe that people are drawn to serve through the career in healthcare because they want to serve. They want to help people.
Certainly.
Sometimes people get into the job and maybe they're not prepared for the monotony. Maybe they're not prepared for the office politics. They're not prepared for crabby patients. And so when we come back together and we use several mantras through all of our training, and one of them is to be introspective, How can I do a better job, but outwardly focused so that my patient has a better experience? So our focus is on the patient experience through our workshops. We also find that a secondary mission is that by doing these workshops, teams become much more collaborative. So if there are difficult issues that members of the team need to discuss, we give them tips and takeaways on how to start those difficult conversations with each other, how to be aware of exclusionary behavior that might impact the patient experience.
Oh my gosh, there's so much there. I can't agree with you more on the culture aspect of a practice. I have unfortunately seen a lot of patients who have left other practices because of exactly what you said,
Right.
where the physician is phenomenal. However, the workflow, the office, the interaction, the communication skills were just not there. And patients are frustrated, even though you can have the best doctor, best interpersonal skills. However, they leave because of the staff. And it's so, so, so true. And you also mentioned incivility.
Yes.
I think of that. So you're thinking about you're talking about incivility maybe among the staff members.
Yes.
When they interact with each other. Okay, I will be the first to admit I was one of those when I first started practice. I was harsh with my staff. I think everyone should be like robots. Everything should be perfect, and it should be like a military operation. But that's just not the case. That is just not how things work. So I had to change as a physician on how to interact with my own staff, because having that culture is truly what's going to make your practice great.
Yes,
that
exactly.
Without a doubt. And the practices that recognize the importance and the value of the staff and cultivates that culture are the ones who I think really succeed. And the staff and the physicians are happier when they come into the office and work.
Well, and at Sunrise Urology, I think that you learned that, and thank you for disclosing that early in your career you had one concept, an idea of how things should go, and realized that really wasn't the culture you wanted to create for your patients, your staff, or your work. So I think at Sunrise Urology, you already know that very well, and you do a very good job here. But you get other patients, or I should say, and you get other patients because they are dissatisfied. I'd like to share one of our exercises that we do around incivility in the workplace. We have a subtitle under incivility in the workplace. It's called accidental communication. So, and then we get to add to the accidental communication this notion of verbal, nonverbal, and then electronic communication, because there's a lot of texting, Instagram, all of that.
I've got a lot of instances in the past where electronic. So I like writing messages and communicate, because you can write one message and communicate the message to everyone in your staff. But the context, the nuance is lost in that electronic message. So I end up pissing off a lot of my staff because the tone is just not conveyed in the electronic message.
And it's accidental communication. You don't mean anything by it.
Correct.
So let me give you an example. So of our communication style, 93% is nonverbal. 7% is verbal. So that's the inflection, that's how the words that we use. You know, we've had some elderly patients that when they will say, well, thank you for your help, and the staff says, oh, no problem. And the patients think, well, I'm glad it's not a problem because I'm a patient and that's why you're getting paid. And, a thank you or you're welcome or my pleasure would be much better.
That word choice is so important.
So important. And how we greet and treat people. So that's the verbal piece. On the nonverbal, we break that 93 out between 55% is body language and the rest is tone. Just as you said, tone. So when we add then to this electronic communication, one of the exercises that we do in our workshops is we take this sentence that I have written right here and I text it to somebody in the workshop in caps. Okay. And I ask them to read the text and they'll say, I didn't tell her you were stupid, which is the sentence.
Okay.
And we'll say, anything special about that text? Well, yeah, it's all in caps, so you must be upset. You must be
shouting.
Yelling at me.
Yes,
you must be yelling at me. And I respond, well, you know what? I did this I didn't have my glasses with me, and so I needed a bigger font to make sure I didn't have any typos, and so I put it in caps so I could read it. Accidental communication. In electronic communication, we do not have the luxury of inflection. So then in regular communication, in our verbal and our nonverbal, The identical words, different meanings, that's the power of the voice. And this is a very, very fun exercise that we do, that you see the light bulb going off. People are, aha. So take the sentence, I didn't tell her you were stupid. And when you emphasize the first word, I didn't tell her you were stupid, that's implying that somebody else told her.
Yeah.
If you emphasize the second word, I didn't tell her you were stupid, but I'm going to.
Right.
I didn't tell her you were stupid, I implied it.
Yeah.
I didn't tell her you were stupid.
You told somebody else.
I didn't tell her you were stupid. Everybody else is stupid.
Okay.
I didn't tell her you were stupid because you still are stupid. I didn't tell her you were stupid. I told her something else about you. So a very simple 8-word sentence means something differently when the inflection is to accidental communication.
Sure.
And then when you have that in electronic communication like a text or an email. You know, early in my career, I didn't realize that if you put your subject line in an email and it was all caps,
you were shouting.
You were shouting at people. I didn't know that until somebody pointed it out to me.
Yeah.
So it's very
you
fun.
just wanted to bring about attention.
Yeah,
You just want to make sure people notice
it.
But yeah.
And, you know, similarly with the phone system, I know that a lot of practices use a phone tree.
Interactive voice response.
Interactive voice response. And it's just kind of the way things are, but there are ways to make that more helpful. We often encourage people to listen to their voicemail system. And if you're playing a nice, soft, relaxing music while your patient is on hold, and then the person who says, sorry to keep you waiting, may I help you? It's like whiplash.
Sure.
You know, you want that answer, that human answer to match whatever was
to match
playing.
The cadence of whatever's in the background.
The rhythm, all of that. And so these little nuances make all the difference in the world. It's like a whiplash for people. And then they're startled and they're not sure what they're supposed to say. And they're already stressed because they're calling the doctor and they've been on hold.
Yeah.
So very often, the receptionist or the front office person, we like to call them the director of first impressions. Very often,
true. That is so true.
They have a relationship repair that they may not even be aware of. If somebody had a hard time finding the practice, if they were on hold, if they got something confused about their date.
Or they're already frustrated because they're calling you because somebody else didn't do something.
Return a phone call or whatever. So there's a lot that the team can do to mitigate a difficult situation. And we spend a lot of time on difficult situations also. Because it can be an organic response. You know, you probably are aware of this, but we draw this scenario that if you're driving on the 202 and it's 10 o'clock at night, you're by yourself and you get rear-ended. You know, the first thing that happens, you know, there are 1,200 chemicals that go through your brain and body when you feel like you're attacked.
Sure.
And in a difficult situation, you very often feel like you're attacked. So you don't want your brain to be the barrier to resolution. So it's a very focused and intentional thought process on how you communicate, verbal, nonverbal, to mitigate those difficult situations with each other or with a patient.
And with a patient.
And with a patient.
So true. I keep saying, so it's interesting that you mentioned the interactive voice response and the voicemail, because on my personal Facebook timeline, I addressed that yesterday. Exactly.
Really? Mm-hmm.
I was talking about how to decrease friction to get patients or potential patients or potential customers into your practice or business. And IVR is one of those barriers. I was thinking in terms of, what if you're the potential customer, would you like an IVR? And also the transition that you mentioned, going from soft music playing in the background while somebody's on hold, and then transitioning into
Exactly.
That's a big transition. Instead of a smooth transition, people are turned into like a fight or flight response, like you said.
Exactly, and that's organic.
Yeah,
that's innate. That's innate.
That's a physical built response. In. That's a survival instinct.
It is, absolutely.
I'll just share with you our practice here. We do everything we can to soften that blow. Mm-hmm. Everything, from the time you walk into the office, there's music playing overhead. There's no CNN. There's no Fox. There's no fake news playing on the TV.
Mm-hmm. Good.
We pretty much touch all the senses for the patient: the smell, the sound, and we try to make it a very pleasant experience. You don't see me wearing a white coat because a lot of people have white coat syndrome.
They do.
So we try to make it as pleasant as possible. And what you brought in, that the subtle things, I never thought about the soft music and then transitioning into an abrupt answer that I never even thought about that. So that's a great point.
Thank you.
Yeah.
I'm glad that you brought up the barriers, because that's one of our very first workshops, is barriers to communication. And when we launch into that, we suggest that you can never eliminate the barriers, because they are things like noise, distraction, communication, physical barriers. So when we talk about the barriers to communication, space, we also say there's ways to manage those, because it's going to be part of the day. Phones are going to ring, sirens are going to go off, doors are going to slam. There's going to be space. Some practices, they have a glass window that gets opened and closed, and just the action of closing the glass window can
we have the same thing.
It's a challenge, and yet you need the privacy. So it's important to find ways to kind of mitigate those. So we give them tips and takeaways on how to compensate for the barriers. Some people might be touch averse because maybe they were touch deprived. Well, you really have no way to know that. But if you're paying attention and you watch the body language as you step in to look into their ear, there's ways to soften all of that. Little self-disclosure, asking permission, and around the diffusing difficult situations, we do a lot of the nod, mirror, lead kind of thing, and how that can take the conversation in the direction that you want it to go.
So I think this is all great to bring about better patient experience, but why does it matter? Why does it matter that you need to bring about that better patient experience?
Well, Dr. Lynn, there's a couple of reasons that I think are key here, and one of them is my own personal. I like to draw the parallel that the people who are in our classes are typically not the highest paid people in the practice.
Sure.
And maybe they don't have the highest education. But if you parallel that with hospitality, and let's take the Ritz-Carlton. Very similar employee profile, and yet everybody on the Ritz-Carlton team understands their role in customer service. I happen to think that the healthcare journey is as important as getting a room at the Ritz-Carlton. People are at their most vulnerable. They are afraid. They don't know. Sometimes a distrust with the system because it's kind of a mess right now.
Sure.
And so I think that it's important that that experience be as pleasant and positive as possible. The other piece, though, is that it makes for a better day for the employees as well.
Yes.
When the employees are equipped with and empowered with these tips and techniques on how to make the patient experience better, they feel like they've served somebody. It's like when you've had a great day with a patient and you've made a difference, they can have that same kind of job satisfaction. It also, in terms of the bottom line for dollars, practices who've been through our workshops tell us that absenteeism has gone down, employee turnover has gone down, patient satisfaction scores have gone up, and we know what that's going to mean with MACRA and reimbursement formulas.
So that's very important that you brought up MACRA, because a lot of practices are worried about that. MACRA is a government mandate which will grade a practice and determine, based on the practice's performance, how much they get paid in the future by Medicare,
That's
which
right.
happens to be the largest insurer in the entire state in the United States. And part of the things that they want us to do is to provide better value, something called the triple aim from the Institute for Health Improvement, and population health, better population health. One of the triple aims is better patient experience. So we are being graded on patient experience, like it or not. Right, and what you just mentioned just plays perfectly into that, providing that better patient experience. And I agree with you. When you have happier staff, happier patients, your patients will actually feel that.
Yes.
It's the nonverbal part of the practice, and when patients feel the warmth in the practice instead of a just very uncaring, mechanical type of a practice, they tend to refer a lot more patients to your practice. And I have seen that firsthand.
I bet you have.
And I agree with you. The numbers prove that out. They really do.
And I think physicians want to connect. I think they're frustrated with all of the paperwork, and we heard the data about data entry clerks that are now the doctors are the highest paid and most educated data entry. You've added a week of work to your month of work because you're doing all of the data entry kinds of things. So I think docs get frustrated by what's going on, and if the team is empowered to make the transition for the patient smoother, and to that point, when you're talking about your early career, we also, in some of our diffusing difficult situation conversations, we also talk about how to manage up. So very often, and this is another personal example, Dr. Lynn, that my father was an educated man. He was a principal, and his education, his master's degree was in education. And when he wasn't feeling well, and he went to the doctor, and the doctor said, "Oh, well, Mr. White, you have multiple myeloma." Well, that didn't mean anything to my dad,
Sure.
and so it just went right over his head. And when Dad went home to talk to Mom, she said, "Well, I think everything's okay." So it was 6 months later when one of my sisters went to the doctor with my parents, and the doctor's talking about infusions and bone marrow, this, and Sherry said,
What
"Wait
are
a
you
second." He
talking
goes, "Well,
about?
6 months ago I told your dad that he had multiple myeloma." Had the physician been watching my dad, an educated man, and got no reaction when he got a cancer diagnosis, he might have rephrased that. So we will work with medical assistants on how to be a translator without embarrassing the physician, without embarrassing the patient, how to be that translator so that everybody feels good about the discussion, to really watch the body language, scope out how the patients are reacting or responding or not to something. And so that, again, speaks to the culture of the organization.
Some of it is just being sensitive, and I think in terms of being empathetic to the patient who doesn't have the medical background or knowledge or the verbiage, understanding of the verbiage. For unfortunately, for a lot of physicians, they're just in that grind of just trying to get through the day, and they don't slow down to think about important topics like this, where you are trying to communicate a very serious diagnosis, and yet the receiver is not understanding at all. Using very basic terms seems to work for me. I talk in terms of instead of saying voiding or urination, I say, well, how are you peeing? Right? So that's something that everybody can
knows.
understand.
That's right.
And instead of a mass or a tumor, if the patient truly has cancer, I will use the word cancer and make sure that point is driven home. So I think that is so important, is just making sure that things are said and not lost in translation.
Exactly. And to that point, we were talking about barriers to communication. One of them is interruption. And that can be an aggravating habit that some people have, because if I interrupt you when you're talking to me, I'm implying that what you're saying is not as important as what I'm saying, and therefore you're not as important as I am. But very often patients will jump in because their mind is running forward on cancer, on peeing, on whatever it might be. Very often when you're interrupted like that, a great way to be sure that the patient is getting the message is you kind of have to back up. And rather than saying, like I was saying before I was rudely interrupted, there's ways to phrase that. Let's be sure that you're clear on what I'm saying here. It's an important part for you to understand. So I'm going to back up a little bit. So those self-disclosures, the language to make it a much more comfortable conversation, put the patient at ease, and the doctor at ease too, because sometimes you have difficult conversations with patients that are hard to have.
Yeah, and a lot of times some patients learn better with words, some patients spoken word, and some patients learn better with written word.
That's right.
And I will supplement cancer discussions with handouts and pathology reports and very layman level literature, so that they can take that home and read and really take time. Because I think I tell my patients when I first give the cancer diagnosis that you're probably only going to remember 10% of what I'm telling you today.
Exactly.
Instead of just dumping a bunch of information that day of giving the diagnosis, if it's something that we can take our time and have the patient return, usually at the end of the day, I will sit down with them and just take my time, have their family members come in, and then just have a very simple, basic discussion that one that they can understand about the implications of their cancer. So that's another way to.
That's great. And sometimes if they're given a little bit of time to digest what you've said, and they'll come back with questions, that's really, they've processed it. I think we all learn and hear differently. Uh, my husband and I happen to be dog lovers, and when we take our dogs to the vet, it's very often they'll run through things, and our dogs are healthy. But when I've had dogs who've not been healthy, and the vet is running through quickly things to do or whatever, they always give me a written report so I can go home and read it. And then if I have questions, well, I didn't hear you say this in our discussion. What does this mean on this particular point? So the written report, we do it for our pets. I wish every practice did it for their patients. I'm glad you do.
Yeah, there's so much information, and there's so much medical verbiage in literature that we or information that we want to relate to the patients, and sometimes that is lost in translation and understanding. So sometimes the handouts help, and sometimes videos.
Exactly.
They will. A lot of
Quick
patients
videos
will.
on that.
Yeah.
Yeah. Something else, if I have just a moment to share,
Sure.
is we also incorporate, in addition to our on-site interactive and customized workshop, and I say customized because the training that we did at a urology practice in Sun City West was very different from the training we did at a radiology practice in upscale Scottsdale. The work is different, the patients are different, the staff is different, so we customize it. So it really does work, and everybody feels really, really good about that. We also incorporate mystery patient assessments, which is a secret shop.
Yes. Oh my gosh.
And it's just like, when the principal walks into a classroom, everybody straightens up.
Sure.
When the leadership walks into a practice, everything's looking great. And the mystery patient assessment is a very helpful tool for the leadership. We have found when we do multiple mystery patient assessments, particularly if there's multiple locations of a practice, we came across one practice where we did 7, and we found out that there was some discrepancy in internal messaging, but there was also some discrepancies in their protocols. One location wasn't doing something like the others. And we don't ever do this in a punitive way. We give the executive report, or we give the report to the leadership with just kind of the facts, ma'am, just what we observed.
Sure.
Or, a lot of times if there's a phone problem, we had one practice that we did several mystery patient assessments, but we couldn't complete the MPAs because they were leaving messages and never got callbacks to schedule appointments. So something was wrong with their phone queue, and they were losing revenue when
wow.
You're losing practice.
I'm glad you did the mystery shopping and figured that out.
And then we also do a train the trainer program. So once practices have gone through our workshop, and it's fun, and they're highly interactive, and we have a lot of exercises.
I was going to ask you, how do you maintain that?
Yes, yeah.
How do you make sure that this carries on?
Well, and part of that is, if you're a musician, the first time you pick up your oboe, you're not going to be a great musician. You have to practice it. So
sure.
there needs to be a dedication and support from leadership to practice this and even to model it. We find that when the providers and the CEOs participate in the workshops, it's much more effective for everybody. But the other piece to this is we do a train the trainer program. After the workshops, we sit down with the emerging leaders or the existing leaders, whomever they like, and we go through tips on effective training. We give them tips to effectively train people, and then we give them the manual. So everything that they practiced and learned and facilitated in the workshops is in this manual. And practices will take one little topic at each staff meeting and review it. And some practices use this to see, we have our eye on this person to promote. Let's see how they do with something like this.
Sure.
So it's and then they have it, and they can practice it. They can customize it to their own. We give them examples of activities, so they're not the same ones that we did in the workshops.
Yeah.
So we do refreshers also. We can come back in 90 or 120 days and do refreshers.
Gosh, such an important role that you all play in making sure that the patients have a phenomenal experience. It's not just good for the patient; it's actually good for the practice. The other piece that we didn't talk about is when you take care of the patients, you take care of the staff, you have less turnover.
Exactly.
Which is extremely costly.
Mm-hmm.
I don't think most practices realize the amount it costs to replace a staff. For someone who's a high turnover type of a low paying role, it takes about 16% of the annual salary to replace that employee. up to 20% of the annual salary for someone making $30,000 to $50,000 a year, and it could cost up to 213% for highly educated executives to replace that person. So turnover is extremely costly, and to have a program like Passion for Patients mitigate that situation, I think it not only promotes generating revenue for the practice, it also saves money in terms of decreasing employee turnover.
It does. And to that point, when you have a culture that staff, they hate to come to work, they call in sick a lot, they'll go down the street for 10 cents more an hour. 65% of people who leave their jobs do so because of incivility in the workplace. And this is exactly what we're talking about, this accidental kind of communication. I didn't tell her you were stupid. Accidental communication. People will hold on to that. They'll take it personally, and they'll look to go someplace else, and that's disruptive for the patient. It's absolutely disruptive for the patient.
I will tell you that I actually personally lived through that because of that accidental communication, and we did have employees leave because of the way I communicated. So I had to learn to change, and we have a great staff right now, and they have all worked here for years.
That's wonderful.
Thankfully, and to the physicians and the leadership listening, you can change. If I can do it, you can too. And for those who are watching, if you have any questions for Gina or myself, feel free to leave them in the comments during live stream. If you're watching this on a replay, feel free to leave them in the comments, and we will be happy to answer them for you. Well, I think we've covered a lot.
We have.
Yeah.
We have.
For people who want to reach you, I know you have a website.
We do.
That is online.
It's passionforpatients.net.
Okay, and phone number's on there for sure.
Absolutely.
And you also have a Facebook page where people can interact with you. And I believe there's some videos on there. And...
Yes, we're going to be updating the website also. We've just done some video work because a lot of people will kind of say, well, show me what you got. Well, we do some classes and we do some complimentary kinds of things, but we can also see our style on the website. And to that point, I've had some physicians ask me about, well, what's my guaranteed return on this investment if I hire you to come in?
Yeah.
And to your point of what you just said, I have anecdotal data to talk about how this works for some practices, but the empirical data comes from the Bureau of Labor Statistics.
Interesting. Okay.
Happy employees, engaged employees equals increased revenue. That comes from the Bureau of Labor Statistics. And so that's in every industry. And clearly, with as disrupted as healthcare is right now, with the assembly line healthcare that people complain about, there's ways that you can change that and add some high touch. It changes everything.
Without disclosing actual numbers, I will tell you that is 100% fact. It does make a huge difference. All right, well, we're going to try to end here. Your contact information, you already mentioned passionforpatients.net.
Yes.
And your phone number is 602-677-1614 for those who want to reach you. And for the viewing audience, I want to hear about future topics that you want me to cover. And feel free to ask questions in the comments. Upcoming shows, I have a radiation oncologist who's going to be coming next week, followed by a senior home placement website assistance, and a primary care physician is going to be coming in to talk about mental health in the upcoming weeks. So I look forward to seeing you, and have a good night.